So hi everyone. Thanks so much for coming to our session here on, I'm going to call it the neuroscience of audition, generally speaking. We're starting off with Erin Glennon, who is a overachieving PhD MD student, going for those simultaneously, who's going to talk to us about neuromodulation enhances plasticity in a rat model of cochlear implant use. She's at NYU School of Medicine under Robert Frumka and Mario Spalitsky, and I will post her Twitter and article in the chat. Yeah, take it away, Erin.
Great, thank you so much for that introduction. So I'll be talking to you today about my thesis work, as Chloe mentioned. I'll start by talking to you guys about the problem of hearing loss and how cochlear implants can be used to treat it. And then I'll move for the bulk of the talk into Noradrenergic neuromodulation, specifically how it's kind of naturally activated by using fiber photometry and how we can harness it to affect behavioral and cortical outcomes using optogenetics. So hearing loss is a disabling condition affecting hundreds of millions of people around the world. But fortunately, one of the most successful neuroprosthetic devices, the cochlear implant, can be used to treat it when there's a complete loss of sensory input. So the cochlear implant is primarily composed of two components, an external and an internal. The external component has this microphone, which picks up sound waves, and then a speech processor, which converts the sound waves into electrical pulses. These are then passed to the internal component, which is primarily made up of an electrode array within the cochlea, and the electrical pulses are sent to individual portions of the auditory nerve. So here we're seeing some patients performing on a word recognition task before and after implantation, as measured by percent words correct. Before implantation, the patients are performing very poorly, but after implantation, their performance increases quite dramatically. However, if we dig a little deeper into this data, we see that there's quite a bit of variability in the individual outcomes, with a significant portion of patients performing less than 50% correct even after this intervention. Furthermore, there's an adaptation period to the cochlear implant. Once the implant is turned on, they're not immediately performing at peak performance. It takes months to years to kind of reach that peak performance, with some patients learning very quickly while others really never get that optimal performance at all. So we see this variability in outcomes and this adaptation period even when we account for differences in etiology of deafness, duration of deafness, and type of implant. And this has led the field to hypothesize for a role of central plasticity in cochlear implant outcomes. However, this can be pretty difficult to address in human patients as it can require rather invasive techniques. And so several labs, including ours, have developed animal models of cochlear implants to try to get more at the central issue. We specifically have developed a rat cochlear implant model in which we're able to insert an 8-electrode array 360 degrees into the cochlea, which is comparable to the insertion depth of good human cochlear implants. And this covers 3 octaves of the rat cochlea. Furthermore, we're able to train our rats to perform behavioral tasks using the cochlear implant. Specifically, I use an acoustic self-initiated go-no-go task. In this task, the animal is trained to respond to a target tone, while withholding from several non-target tones. So in an individual trial, the animal initiates by nose poking, and then a tone is played. If it's the target tone, the animal should respond in a detection port and receives a reward. For a non-target tone or foil, the animal should withhold. So on the right here, we're seeing a very well-trained animal responding highly to the target tone while barely responding to the non-targets. We assess performance on this with a metric called D prime, which is the difference between the Z-score of the hit rate and the Z-score of the false positive rate. An animal who can perform the task has a D prime of about 1 or above, with obviously very good performance at D primes of 3, whereas poorly performing animals around chance of D prime of 0 or even negative. I like to consider my rats post-lingually deaf because I train them while they're normal hearing, and so they kind of learn the task, and then I bilaterally deafen them and unilaterally implant them. And then I train them again, but now using the cochlear implant. So here we see an individual cochlear implanted animal who has been trained for several days and is now performing the task using the implant. Again, responding highly to the target while withholding from non-targets. On the x-axis now, rather instead of tones, you're seeing the individual cochlear implant channels that are being stimulated. However, if we turn the cochlear implant off, this animal's performance plummets and they're essentially performing at chance. This holds true across many animals that I have trained who are able, with the implant on, to perform above our criteria of a D prime of 1, but with the implant off, it drops to chance. So now that we have this model in place to kind of look at how learning is happening, we are trying to, as I mentioned, get under the hood and look at how neuromodulation is playing a role. Specifically, we start by looking at noradrenergic plasticity. Noradrenaline, or norepinephrine, is a neuromodulator produced by the small brainstem nucleus, the locus coeruleus, which is involved in attention, arousal, learning, and responds to very surprising or noxious stimuli. And several groups, including ours, have shown that activity of the locus coeruleus can be used to enable plasticity across sensory modalities. So we were curious what's actually happening in the locus coeruleus during cochlear implant learning. To get at that, we used the fibrophotometry in the locus coeruleus of rats. Fibrophotometry is a technique that utilizes the fluorescent calcium indicator GCamp, and I'm able to specifically express it in tyrosine hydroxylase Cree rats, so it's only in the noradrenergic cells of the locus coeruleus, and place an optic fiber to record the bulk fluorescent changes. And so you can see down here on the left, a recording from an animal who has just kind of this positive noxious stimulus for the LC tail pinch. And on the right here is my setup for when I'm recording from the animal's locus coeruleus while they're training with the cochlear implant. So what's actually happening in the locus coeruleus when the animal is starting to learn? So when we first turn on the cochlear implant for the rats, they are only being exposed to the target tone. So here we're looking at activity in the locus coeruleus while the animal is learning that the target tone gets rewarded. These are the average of many trials on day 3. And if you align the locus coeruleus activity to the tone onset, we don't see any clear activity, but when aligned to the reward, so the nose poke then is followed by reward presentation, we see a nice evoked response in the LC. However, once the animal becomes very good at this task and it's no longer kind of surprising that this reward is arising, we don't see any clear evoked activity anymore. At this point, we then introduce foils to the rat, and we see that the animal is not discriminating between the foil tones or the targets. And again, we're still seeing this kind of flat activity within the locus coeruleus. However, as the animal begins to discriminate between the target tone and the non-targets, we see a nice tone-evoked activity emerging, but only to the target tone in blue, not to the foil tone. And this, in fact, actually precedes the reward presentation. So what we're seeing is a nice correlation with tone-aligned locus coeruleus activity to performance on the task. And we wanted to see if we could harness that to kind of improve performance and affect outcomes. So that's when we moved into the stimulation or optogenetic side of things. So again, I'm using my tyrosine hydroxylase Cree rats, but now instead of GCamp in the LC, I'm expressing channel rhodopsin in order to activate the LC with optic stimulation. I confirm placement of the optic fiber using CT MRI co-registration in collaboration with the NYU Preclinical Imaging Core. And for our actual stimulation paradigm, we utilize what we call an offline pairing paradigm. So I just want to emphasize that the stimulation doesn't happen during the actual behavioral training, but happens in a session that precedes that. During that session, we simultaneously play the target tone while optogenetically stimulating the locus coeruleus. In order to control for this additional exposure with the cochlear implant, we also have sham locus coeruleus implanted animals that have YFP instead of channel rhodopsin in the locus coeruleus. So here are those sham animals performing across many days with the cochlear implant. They're all able to learn, but there's quite a bit of variability in the outcomes, similar to what we saw actually in our human patients. However, if we add in the locus coeruleus stimulation, we see quite a bit of improvement, including on the peak D primes that are reached. This is also exemplified by the fact that the learning rates are much quicker in our locus coeruleus paired animals who consistently reach our criteria of a D prime of 1 more quickly than our sham animals. So what's actually happening centrally, though? Is there some sort of cortical representation of this? In order to get at that, after I've trained my animals, I anesthetize them and conduct multi-unit recordings in the auditory cortex that correspond to stimulations that I'm doing with the cochlear implant. So here we're seeing some of these responses in the auditory cortex. Here are some individual traces up top in either a sham-paired or an LC-paired animal. And what we're looking at are individual recording sites on the y-axis across the auditory cortex, and these are the individual channels, and the color represents the Z-scored activation of the auditory cortex. In the sham-paired animal, we don't see really any clear pattern to activation. However, in our LC-paired animal, we see that consistently the target channel, which is outlined in red, is the best channel activating the auditory cortex most highly. And this holds true across animals. So here we're looking at sham-paired animals versus locus coeruleus paired animals with activity broken down between either a foil or non-target channel and the target channel. Not a consistent difference necessarily between the sham-paired target and foil, whereas more consistently, the LC-paired animal has higher activation of the target. And we can turn this into a neural D prime, where I'm subtracting this, the Z-score of the foils from the Z-scores of the targets. And we see that that actually pretty nicely correlates with our behavioral D prime. So perhaps by driving this increased representation of the target channel, we're helping the animal perform on this task. And so with that, I'd just like to wrap up, tell you about how I've set up this behaviorally and physiologically calibrated rat cochlear implant system that mirrors the variability and outcomes that we see in humans. I've been able to measure locus coeruleus activity during learning with the cochlear implant and see a nice kind of correlation through the learning. And I've shown that neuromodulation paired with cochlear implant learning can enhance behavioral outcomes as well as neural representations. So with that, I'd like to thank you all for listening, as well as my mentors, Rob and Mario, a wonderful research fellow, Angela Zhu, who's helped me a lot with this project, and all of our labs. So.
That's awesome. And we have 2 minutes for questions from the audience.
Okay. I'm not seeing any questions so far, but thank you, Katerina.
Sorry, we have a fantastic talk note. Not a question, but just generally good to have praise. So yeah, so I guess I have a question. Not being in this field at all, sort of what is the next step for this? Like how do you relate these back to, I guess the ultimate goal is a human patient, or right?
Right. So there's something that's very in vogue right now, maybe you've heard of, is vagal nerve stimulation. And so vagal nerve is thought to activate the locus coeruleus as well as the nucleus basalis. And so the idea is hopefully we'll be able to kind of translate that over, because vagal nerve stimulation is really evolving in terms of having transcutaneous stimulators and things like that. So actually we're in the process of getting some human studies with the transcutaneous vagal nerve cuffs up. Awesome. Or vagal nerve stimulators.
Very cool. So we have this question from Katerina Ducker, excuse me if I butchered that. It looks like animals in the stimulation condition were able to suppress the stimulus and at the same time boost the target sound. Do you have an explanation for that?
Suppress the stimulus. I'm not sure. The foil sound. Okay, yes. So that is, I kind of think about that in terms of some of my normal hearing work that Chloe might have posted. Actually, what we see is with the locus coeruleus pairing, it not only increases the representation of what you're pairing the sounds for, but it can potentiate other representations. So you can kind of switch how well neurons or animals are responding to certain tones, meaning you can switch the best frequency or how they are responding in terms of behavior, partially by kind of suppressing that previous best frequency.
Awesome. And we will move on now to Kathleen.